Today's second topic is adolescent health. So it's interesting that only in the last iteration of Healthy People 2020 has adolescent health been included as a special topic area. The goal for adolescent health is to improve the development and health and safety of adolescents because we are given a unique opportunity to try to influence adolescents before they move into adulthood. So when we're talking about adolescents, we're looking at ages 10 to 19 and young adults 20 to 24. They make up a fifth of the US population. And generally this period during the lifespan is really one of good health. Like maybe you even find yourself, I wish I was the weight I was when I was a teenager, 19. I was so strong then, I was fit, I was full of energy. But what behavioral patterns are established during these years really set a really good indication of how your health status is going to be from that point forward. I know for a lot of school-age children, physical education requirements have decreased significantly, and for many that was the only physical education that they would get. And what is happening? We have, the largest rates of obesity and overweight in our young children, and this tends to persist over the lifespan. So the burdens in terms of finances for preventable health problems that are experienced in adolescence are tremendous. And one example is tobacco. Like typically a smoker will start before the age of 18, and the cost to care for them throughout their life, even though they are likely going to be associated with premature death and disability, is $193 billion. So as you can see, the US federal government has a huge economic stake in preventing chronic disease among adolescents. This is a really, really important time to try to influence the behaviors that will become habit for the rest of their life. And among adolescents, there are disparities in outcomes, no surprise, among racial and ethnic groups. So adolescents who are African American, American Indian, Native Alaskan, Hispanic, those who live in poverty are going to experience worse outcomes, especially obesity, pregnancy, tooth decay, educational achievement, compared to adolescents and young adults who are white. Now, as I mentioned before, generally adolescence is marked by good health, but there's all sorts of social environmental influences that really start to emerge in adolescence, and a lot of it has to do with the transition of growing up and then being part of groups such as gangs, being so in certain areas homicide is a real health threat, suicide. There are a lot of motor vehicle crashes among young drivers and adolescent drivers. And many are caused by drinking and driving and now distracted driving. Substance use and abuse. People are trying a range of substances at very young ages in schools. Smoking behavior starts. Sexual initiation starts, and so the risk of STIs, sexually transmitted infection, including HIV, becomes more prevalent during adolescence. And then teen and unplanned pregnancies, over 51% of all pregnancies are unplanned. And then homelessness is also a concern. Some young adults age out of foster care, and for children who are wards of the state who have been taken care of by either state-appointed guardians, are often transitioned and graduated out, and if they didn't successfully complete school and break the cycle of poverty, many find themselves in the situation of being homeless, which puts them at risk for committing crimes for survival, which might get them incarcerated. So as hopefully I am describing, these statistics show why it's so important to really consider intervening and examining the unique health needs of adolescents. And so not only do we have the developmental, we're becoming an adult, which I'll always remember from my epidemiology class, the 4 I's associated with adolescence. Like if we look at the health data surrounding adolescence, what are teens and young adults most likely to suffer from? You know, if you had anybody in your high school who passed away, likely it was a car accident. Sometimes people can die from, you know, pediatric cancers or other genetic illnesses, etc. But those are typically rare. But the 4 I's relate to young adolescents who have a belief and notion in being invincible, and they are disabled or die early from injury. They have a notion that they are going to live forever, the feeling of being immortal. And interestingly, brain development isn't, the brain matures fully at age 25. So it's really no mystery why car insurance companies and rentals, they won't give you, you know, a break until you're 25 and older when the brain is fully developed. There is an intentional reason that bar is set. So, and part of the brain to develop, the last is the long-term vision, that knowing you are not going to live forever. If you ask an adolescent long-term when you're older or thinking about retirement, they do not even have the capacity to think that way. The other 2 I's, one is being immune. So, you know, when you in health class during high school, you might have seen all these pictures, the clinical pictures of what STDs and sexually transmitted infections look like, but the capacity to know you're not immune from all of that is hard to grasp. And so sometimes those approaches in health education are not going to be effective if you're working with adolescents. And then the final I of the 4 I's is being infertile. Teens just don't think their one night stand, one, you know, boyfriend or girlfriend of an intimate moment could actually lead to pregnancy. And so teen pregnancy is a major concern. It's going to have major influence on your life, your educational attainment, income earning potential, etc. So some of the really effective policies and programs that have been developed in response to these trends in adolescent health and outcomes include restructuring graduated driver licensing programs so that there's longer periods of time before adolescent gets their permit to actually achieving full driver status. There's a number of really excellent exemplary evidence-based teen pregnancy prevention programs, violence prevention programs, delinquency prevention programs, mental health and substance abuse interventions, and HIV prevention interventions. If you're interested in other areas of adolescent health beyond those that are directly included in the adolescent health topic of Healthy People 2020, there are a number of linked areas that have specific objectives for adolescents, and these include access to health services, disability and health, education and community-based programs, injury and violence prevention, lesbian, gay, bisexual and transgender health, as well as more through that web. So level as well. So how does the family influence adolescents? Adolescents who perceive that they have really good communication and a great bond with an adult, they're less likely to engage in risky behaviors. Parents who provide supervision and are involved with their adolescent activities are going to promote a safe environment in which to explore opportunities. But I do have to add a caveat that parents can provide supervision and be very engaged and active and have good communication, and adolescents still can engage in risky behaviors and have negative health outcomes. Just generally, this is the pattern. And then children of families living in poverty are more likely to have poorer health status overall and poorer health conditions. They're going to lack access to healthcare, and therefore their utilization rates are going to be lower. On the school front, the school environment plays a major role in overall health and well-being of adolescents. Academic success and achievement predicts overall adult health outcomes in the long term. The more proficient academically adolescents are, it's associated with lower rates of risky behaviors, higher rates of healthy behaviors. High school graduation is linked to lower rates of health problems, lower rates of incarceration, and enhanced financial stability during adulthood. And then the school's social environment affects a student's attendance, the academic achievement, and their overall conduct and behavior. So a safe and healthy school environment promotes engagement and protects against risky behaviors and dropping out. The impact of neighborhood and social media and the media in general do play a role in adolescent health as well. So adolescents that grow up in distressed neighborhoods are characterized by having concentrated poverty, what formerly used to be the public assistance projects, public housing projects. They typically would have a whole range of negative outcomes, including poor physical and mental health, delinquency, higher sexual risky behaviors. In media, adolescents that are exposed to media and violence, sexual content, smoking, and drinking are at risk for adopting these behaviors as well, because they normalize those behaviors. It becomes part of their social fabric. So where are we headed for adolescent health in the future? Well, adolescent health and the whole population is really dynamically changing. It's becoming more ethnically diverse. We have a really great increase in the number of Hispanic and Asian American youth. And this shifting ethnic diversity requires cultural responsiveness. We talked about that in the previous session. We need to be very sensitive and have sharpened attention to how disparate health and academic outcomes that are driven by SES and poverty, really tie into health, preventive behaviors, self-care, etc. And being really cognizant of these differences among adolescents from different groups and varied backgrounds is going to be especially important. And then we need to increase our focus on positive development interventions for preventing adolescent health risk. I think a lot of times we respond negatively, or we have an air of being patronizing with some of our health promotion efforts, but some of the most effective interventions are created by adolescents themselves. They have a much better way of crafting messaging and content that can connect with adolescents in a way that conveys the sense of the health benefits of doing so. And then for any new health promotion effort, I cannot underscore the importance of rigorous evaluation. We need to always be able to explain and capture data to explain what works, why it's working, and how we can take these interventions and disseminate them on a wide scale when evidence is truly achieved, when we can show demonstrable outcomes of our efforts. And with that, please work through the module materials, and thank you.